The Best SFA is a trial studying two diverse strategies for femoropopliteal interventions. It's a pilot study comprising 120 patients, and the background really is that for most industry-funded clinical trials, the use of adjunctive devices before drug-eluting technologies, so before both drug-coated balloons and drug-eluting stents, was actually prohibited. So it was not possible to use specialty devices for lesion preparation, devices such as scoring balloons, high-pressure balloons, but also atherectomy devices or intravascular lithotripsy. We know on the other side, for clinical routine, we really know that we do need these devices for complex lesion treatment. And so we wanted to design a trial who is actually encouraging the use of these devices before randomizing the patients into a stent-preferred strategy. And here there would be performed full lesion coverage with the Illuvia drug-eluting stent versus a stent-avoiding strategy. And here the operators could use various clinically proven drug-coated balloons. So that was the background. We wanted to see what we can achieve if we combine these two options. First of all, I think it's important to look at the study population. So we included patients with symptomatic femoropopliteal disease, Rutherford category 2 to 4, and who had long and complex lesions. So the minimum lesion length was 10 centimeters to be included and 5 centimeters for completely occluded lesions. But what we found out, what we actually did include in the clinical trial are very long complex lesions. So we had a mean lesion length of around 18 to 90 centimeters, but most importantly, 80% of our patients presented with chronic total occlusions. So this is really a chronic total occlusion trial, I would say so. And also 2/3 of patients exhibited quite severe calcification in this trial. Several. First, that we included so complex lesions, I would say so. Then what I haven't mentioned is what was used for lesion preparation, because that was at the operator's discretion. So we saw that before stenting, people would use in about 50% of cases a certain methodology for lesion preparation. So half of it was maybe 40% was use of scoring balloons, specialty balloons, and the rest of it was various atherectomy devices. On the other hand, in the stent-avoiding group, lesion preparation was done in about 70% of lesions, also with a similar proportion of scoring and various atherectomy devices. So in most cases, with respect to atherectomy, the TurboHawk device was used for plaque modification. So that was interesting to see what's really used in clinical routine. Another interesting finding is that despite we had really good lesion preparation, especially in the drug-coated balloon group, there was still a quite relevant percentage where the residual stenosis was above 30% at the final angiogram, and we know that this is related also to worse patency outcomes. Another aspect that surprised me is that we didn't really see a drop of the patency curve at 6 months, but really at 12 months. And here it will be interesting to see what the 2-year follow-up will show. Oh yes, oh my goodness, many limitations. First of all, the sample size. So we included 120 patients because this was really a pilot study. This was not designed with a superiority or inferiority hypothesis. It was really the idea to get a little bit a glimpse what is done in clinical routine, what would people use for lesion preparation, and what would we see as acute and, of course, a bit more long-term outcomes here. And I think that's important. We will follow up these patients for 5 years. That will give us more insights. I hope so. I really think the additive value of lesion preparation has a little bit more clearly to be defined. Of course, we think it helps to reduce recoil dissections, to reduce the bailout stenting rate. It might support the use of drug-coated balloons by reducing the amount of calcium and allowing more paclitaxel to be transferred to the vessel wall. But so far, we haven't really shown improved outcomes with these strategies, and it will be just very important to have some studies going on that will focus on this question.